Hello and welcome. I'm Vincent Makori. This is Africa 54. A Texas nurse who treated the Liberian Ebola patient Thomas Eric Duncan has tested positive for the deadly virus. She becomes the first known case of the disease being contracted in the United States. And meanwhile, Western nations are boosting measures to guard against Ebola as its global reach expands. Passengers arriving from Liberia, Sierra Leone and Guinea are part of the new measures.
We'll provide a CDC fact sheet outlining the signs and symptoms of Ebola. And the passenger is then going to be directed to a private area where the individual completes a CDC questionnaire and contact information. Customs and Border Protection has authorized and coordinated medical staff that will take the traveler's temperature and assess if it is within a normal range.
Many travelers welcome the extra precautions.
It is worth it. Whatever you can do to prevent something drastic is worth it. Any inconvenience, we go through, it will be worth it for safety.
The new procedures will expand to 4 additional airports this week. Together, the 5 U.S. airports receive more than 90% of all travelers entering the United States from 3 worst affected West African countries.
We can't get the risk to zero. That will not be the case, but this additional layer should add a measure of security and assurance to the American public. This entry screening procedure, for example, would not necessarily have caught the patient in Dallas as indicated, and no port of exit or port of entry or airline response procedure will supplant the need for state and local public health departments, clinics, hospitals to be prepared to detect a case might it occur.
Britain held a drill Saturday to test the country's ability to handle an Ebola outbreak as the country also begins Ebola screening at certain airports and train stations. The World Health Organization says the worldwide Ebola death toll has topped 4,000. In Spain's capital, Madrid, 16 people now are being monitored for the Ebola virus. The hospitalizations come after a Spanish nurse was diagnosed with Ebola following her care for 2 Spanish priests who died of the disease in Spain after contracting it in Africa. Officials said Saturday the nurse was in serious but stable condition. More now on the case of the Texas nurse who became infected while treating Thomas Eric Duncan. Dr. Thomas Frieden, director of the U.S. Centers for Disease Control and Prevention, is calling for an investigation into how the unidentified nurse became infected. He says there must have been a protocol breach that caused her to become infected. But some healthcare experts refute that assertion, saying it shows how far U.S. hospitals are from adequately training staff to deal with the deadly virus.